All right, hi everybody. It's Tuesday, 8th of March. This is OSA Mur Ligase meeting. And I will share screen so that you are seeing what I'm seeing, which I think is probably this guy. And I just need to move that out of the way. So you've got that. Okay. Okay, so we're on the call here so far. Just want to make sure we've got the right people. Okay, so I guess the last time we were looking at a bunch of data on the from Becker about the dual inhibition capabilities of these molecules that Dana had synthesized, and saw the data that suggested that some molecules appeared to be giving some dual inhibition with a correct dose response curve. We had taken one of those compounds and we have designed some variants of that, which seem reasonable in terms of exploring the compound that was looking the most reasonable. I think they are, if I've linked this correctly here. So Kato and Ed have been playing around with the structures which gave the nice results, just so we can have a go at some more compounds for enzymatic screening. And I think these all look reasonable. They've got, extra mass, varied possibilities for evaluation. They're reasonably inexpensive. They've got good calculated log p values. So unless there's any cries of dissent, we're going to go ahead with making a bunch of those and sending those off to Warwick in the short term. There was discussion last time about whether or not we could determine if these compounds were competitive inhibitors. I wasn't sure what the action was there for either Laura or Becker to maybe comment on in terms of working out what these compounds might be doing. Does anyone want to address that now?
So hi, I'm Laura.
Hi, Laura.
I think I was going to do some essays for competition against ATP. I don't see her on the list of people joined, but I know she started doing the essays. So maybe later if she joins, then maybe she can address that. But I haven't seen her, so I haven't been able to talk to her. Okay,
fine. Right, but that was the idea that ideally Becca was going to try and do some competition essays with ATP.
Yes.
Okay, great. Thank you.
No problem.
And then on these compounds, I mean, we've measured their ability to inhibit Mur-D and Mur-E. I guess that we saw your data last time, Laura, of the crystallography that you were doing with these compounds and protein.
Yes.
And I think you were going to try and pursue co-crystallization experiments. Do you have an update you want to share, or?
I haven't gotten good crystals yet. There are some crystals growing, but they're very tiny.
Right.
So I'm trying to optimize those and see if I can get bigger crystals. They are microcrystals, basically. And then if that progress, then obviously I will be doing testing of diffraction and collection in April, because the diamond is shut down until April, the first week of April. So a few more weeks and see if I can get something in a few more weeks.
Okay, great. I guess maybe this is the time to address your comment recently, Joe, about whether we should be attempting crystallography using truncated protein, which you posted. Do you want to talk about that now?
Sure.
I kind of would prefer to talk about it when Jan is here, because he probably is the most familiar with our constructs.
He's on the line, so
yeah,
Jan wants
he's
to
driving.
join.
But he's behind he can't look at his computer and his stuff, right? He's
not
going to be able to.
Driving for a bit.
All right. Oh, he mentioned that. Okay, that's fine.
Okay, all good. We can do that later in that case. That's fine. Okay, so and we heard last time data from Becker and data from Chris Dowson's team on the enzymatic assays. If I could just try and encourage the team to post the data that they had, because we saw it on the screen as part of the presentation, but it's always nice to have the data, if we can, for this project posted somewhere. I think Chris isn't quite with us yet, but
I will let them know. Chris is away this week, so I'm not sure he's gonna join.
okay, no worries.
Yeah.
All right.
But I can let her know.
All right, thanks. Because yeah, I mean, it started a conversation last time about how these inhibitors are performing, in the sense that we saw inhibition with some compounds that were known from the AstraZeneca work to be highly potent inhibitors, but we were getting 1,000-fold differences from those potencies in the assay. So I guess it would just be useful to have the data there so we can see exactly what was done.
Yes.
I think we talked last time about why it might be that we have different potencies, because of course the assays may not be completely equivalent, but it's important to keep an eye on it.
Yep.
Yeah, there was a long, sorry, maybe it was offline, I don't remember, but Adrian sent me we had a long exchange about the assays and the differences and so on. And I guess I was satisfied with, I mean, obviously I've put a ton of work in Chris's Thousand's group on, Mur Ligase enzymology and stuff. And so, but I know they were going to look at things, but I think in general, the relative potencies are okay. I think the issue, the concern I had was just being able to identify really weak inhibitors. And I think that was something they were going to look into. But yeah, I guess Chris is not, excuse me, Adrian is not on the line this time, but, but we can follow up on it, I guess, next time.
Yeah, I guess I'm thinking also about, when we send compounds for evaluation, we just need to make sure that we have the same controls each time. I mean, is that a way to mitigate that?
Yeah, I think that's a good idea.
Okay. All right.
Yeah. Well, we have here the compound from Yuhang. We could still use that one.
Yep.
Until we get the AZ compound. And I
Yep.
don't know if it arrived or not, because that would have gotten to Adrian. So,
Okay.
That
Yeah,
AZ
Yuhang,
compound, I
shipped.
thought,
Sorry.
my understanding was that already had arrived.
all right,
Like
then
a month or more than a month ago, I think, because there was an exchange
Okay, good.
between. But I think the challenge here is at least we don't have a good. The AZ compound will give you a reference from Mur C, but I don't think we have any good references, for
No.
example, from Mur D.
No, they are using other things to inhibit ADP, CP, and other things. So they're looking into that as well. I know they were looking into different inhibitors. Yeah.
That's a good point, though. Yeah, I mean, is there a good known literature inhibitor of Mur D, or are we in the dark?
As far as I know, you're in the dark, other than
Yeah.
comparing it to, like ADP. I mean, I guess like the KM or something, of ADP. But otherwise, I'm not sure. I'm not aware of any other real Mur D ATP competitive inhibitors.
No, I think for Mur D, they were looking into ADP, CP, if I remember correctly.
Yeah.
Okay. All right. Interesting.
I guess just on that comment, I'm sorry, I just jumped in on that, but
Yeah.
I think that's the other challenge, I guess, when we talk more about crystallography, I guess we bring it up then, but there are very few examples of actual crystal structures of an ATP bound Mur ligase inhibitor other than the AZ compound. I mean, everything else is basically ADP, or there was stuff that was done in the UMA pocket, but in terms of
Yep.
ATP itself, the only really good structures we have.
Yeah.
Well, actually, there's a second one, which is the diamond Mur E small fragment. But yeah, there's just very few examples of bound inhibitors at the ATP pocket and Mur ligase.
Yeah.
Okay. So the other things, I guess, just talking about the enzymatic assay, is that we obviously were hoping to get evaluation of the atomized compounds in that assay. Do you happen to know, Laura, if that's been taking place?
So I know they were trying to address the problems with the KIs and seeing if they can lower down the concentration of enzyme to the high throughput screens. So the last time it was working and they were gonna start planning the screen, but I don't know if everything went okay in the last checks or not, because Adrian is away as well, so I haven't been able update with anyone this week.
Okay.
Yeah, so I know they're working on it quite actively. So yeah,
All right.
hopefully we'll get that soon.
Okay.
The
Yeah.
otherwise and the enamine as well. So there are plans for both of them.
Yeah. Okay. All right. Great. So just before we talk about anything on the SPR, just wanted to mention this thing that I've been in email correspondence with Chris and Laura and others about, which is this rather cryptic thing. So we got some money from EPSSC and UCL to run a competition over the coming 4 months, basically until the end of June, to run a competition to ask people working in the AI machine learning field who are using generative methods, so not virtual screening of large libraries, but generating molecules that meet certain criteria, that will bind to a Mur ligase. So the idea is that when the competition is started, which we wanted to do this week, we will be going out to a bunch of companies and academic groups saying, do you want to have a go at this challenge? If you can suggest molecules for us to purchase or make, we'll do that, and we'll send them to Warwick for evaluation. And we'll try and fit in as many cycles of that as we can before the end of the grant. It's very short term, this. It's got to be done pretty quickly. Mm-hmm. And Ed will be doing the synthesis and the procurement of the molecules. We've done this before with open source malaria for a phenotypic drug discovery project. This time it's target-based and it's specifically about generative modeling, which is tough. The key is to make sure that the rules are simple. So the operational rules are simple. We know how to run this kind of thing, but the science rules need to be really crystal clear for this. And I want to make sure that we're giving people the right advice. So I want to make sure we're giving them exactly the right target structure to work with, and any clues we might have as to other compounds like fragments that are binding in the same place that we're interested in. So my default position here was that we could go with the atomwise situation of asking them to predict molecules that will bind in the same place as we asked atomwise to predict molecules, which is this 3UAG structure with bound substrate, and use the same relevant amino acid residues as we defined for the atomwise project. But what I'm out of my depth here in knowing whether that is the best thing we could be doing as a target for the generative guys. Does anybody have any advice for us about specifically what we should be asking people to predict molecules for?
I guess I don't, but I have a question on this. I mean, we dock to a different target, right? A different crystal structure, but is this more D or more C? I guess I'm not.
It doesn't. It can be anything. I want it to be something that we think will give us that we can measure, right? Firstly, and secondly, that will be of maximal use according to people's views on this call.
Mm-hmm.
So it could be the same as what you've been doing, Jan.
Yeah. I mean, is this competition open to anyone? I mean, yeah. I guess you already have our entries then, I would say.
Yeah, so it depends. I didn't clock whether your method was generative or whether it was linked to specifically virtual screening of commercial libraries.
Both.
No, it's, no, it's generative. So the models, with one exception, the models we predict are completely novel, right? Can't be bought, in the sense.
Yeah.
Well, one of the problems will be that using generative models, you are going to have to make a lot of compounds.
Well, it depends. It depends how complicated the molecules are, right? So on a related project, we were working with some people on a generative model for the coronavirus NSP13 helicase. And of about 30 molecules or so came in from that. Within certain constraints of the pharmacophore model and molecular weight and log P and everything. And roughly half of them are purchasable. So I guess it just depends, right, what you get.
Yeah, I guess, one other issue with the generative models is that in general, you need some kind of training data. like you had with the malaria, right? So on the order of, a few hundred compounds that you can train on. And as far as I know, there's very little data on this, right?
Yeah, I don't. So it seems like, if we have a few fragments bound somewhere, that gives people a starting point. But the guy I was talking to at UCL, who is going to be entering this thing and getting people interested, said he doesn't need anything bound. He just needs the protein structure.
Okay.
So it's going to predict binding affinity as a scoring function.
Yeah, and use some evidence of which residues might be important as a guide, and then molecular weight, log P, things like that, and then go for it.
Yeah, I mean that's I guess back to true de novo design as opposed to virtual screening.
Indeed.
So I guess the one thing, my input to you, Matt, would be that you need to kind of work through with Chris Dowson's group is actually which isozyme that they feel they can actually run the assay on. Again, that's been yeah, I guess that's the key thing, right? Ultimately, you want to test these biochemically, and which assay they feel they have the most confidence, comfort level, ability to screen compounds.
So for a few compounds, because it's not going to be a lot of compounds in one go. So for a few compounds, we already have assays that can be tested for all of them.
Yeah, well, it'd be great to see. Well, it'd be great to see some data. I mean, I'm sorry to be a pain in the ass here.
No,
but
I know.
It'd be great to see some data. We haven't seen very much data. So
Yeah.
the practical point here is if you're asking people to put effort in to generate ideas, it would be great to see them tested. I've been waiting 3 years now for my compounds to be tested, so that's why I'm a little
yeah, I know, I understand.
sensitive about this issue about actually getting data out of the biochemical assays.
Yeah, I understand you. I also offer SPR, which is where I can, I can be of a better input because I'm not doing the essays. Yeah, so SPR, I can get that done pretty fast.
Yeah, so specifically on that, I mean, some of these molecules may be very weak binders.
Yeah, so the SPR will pick up as well very weak binders.
Yeah, so in that case, if we wanted to screen these compounds by SPR, from your perspective, and if we're talking about, I don't know, 30 compounds a month or something like that, something like that, what should we ask people to predict binders for?
So things like, what do we want to use these compounds for? If it's again for dual inhibitors or multiple inhibitors, then I think we should keep going with the same pockets that we're doing. The ATP side, for example, something like that. But
for MUR-D,
if not, yeah, for MUR-D or MUR-E, things that we are already working on, right? To build up or continue building up on the work that we are doing. I don't think we should start something completely different. But
in which case, it's the same challenge as Atomwise had then.
Yeah.
Isn't it? And that means 3 UAG with bound substrate, right? Because that's UMA bound, right?
Yeah.
And that's the most, so in terms of the SPR assay, then molecules that are predicted to bind that structure should come up ideally on the SPR assay.
You should. I can also run in the presence of substrates or in the presence of other molecules, and we can have semi-complex. Yeah, I can do a few things on that. But yeah, on the SPR, in principle, is an apoprotein, right? But then I could add more things into the buffer, the assay buffer, if we want to have different complexes as well as a compound. If the compound is competing against the ATP, imagine, then it's more likely to see the binding if there is no ATP there, if it's a very weak binder.
Right. Yeah. I mean, ultimately, we're trying to figure out, if these compounds are weakly binding, we just want to make sure we can pick them up.
So that, we can start with the APO. If we see nothing, then we can do other rounds. But for 30 compounds, in a couple of days, I can have 2-3 days and have the dose response.
Okay, perfect. I mean, I think we have to go with that. We originally planned this project to be one versus the NSP13 helicase, but we can only access an ATPase assay. We can't access a biophysical assay.
Yeah.
And I think given that some of these compounds are going to be weak binders, we have to go with something which is SPR based.
Yeah, we can try that.
If that's okay, then we're going to carry on with
I'm fine with it. Yeah. And
Three
then
images.
if we can add essays, would be an extra, right? So yeah, I'll try to get that coordinated.
Okay. All right, great. Because we're going to try and launch this on Friday and start reaching out to companies who might want to take part. And we just have to make sure that the description is super brief, right? So they understand exactly what they've got to do.
Yes.
So I guess I'm sorry, as usual. I'm a little confused now. So the atom-wise, did you ever determine what atom-wise actually used and what they actually targeted?
Yep. So they hang on a second. I've got this here. Don't need to talk about it. You'll be pleased to know Atomize have reached out, and we are due to set up a call with them. The reason why our original inquiries were going unanswered is because our original science contact left Atomize a year ago. but no one had an out of office on. So we now, I think, have a new person, and we will be in touch with them ASAP. So this was it's in the original proposal document, the one that Chris Swain actually submitted. And their determination was from the 3UAG structure, these were the relevant residues. I was weighing on just some insights from the Warwick team about whether or not the compounds seen on the crystal structures were interacting. Whether the atomized compounds seen in the crystal structures were interacting with some of these residues.
Yeah, I did reply to that.
Oh, I'm sorry. Right.
Where is it?
Yeah, it's on screen.
Oh yeah, there you are. Sorry, I just thought it was your email because it was smart. Yeah, so there were some residues that were common between both, but they were not key interactors with any of the hits that we got.
So some of the atomized compounds
I think a couple of them, if I remember correctly.
Right.
3
overlaps and a couple of residues.
Yes.
So there are some residues, but does that imply that the atomized compounds are overlapping with residues that were not included?
Yes. Because the thing is that these compounds were binding in a new pocket that was not available in the 3AU model. So that means, the interaction is different, so there's not much overlap in there.
I'm sorry, I'm still confused. So we have the XChem fragments, right? And in this quote, what we think we might be calling an allosteric pocket, correct?
Yeah.
And we have the ATP pocket or ADP pocket, and we have UMA pocket, right?
Yeah.
So these compounds from atom-wise, are they in the ATP pocket, or there's a new pocket?
In the allosteric one, yeah.
They're in the allosteric pocket, similar to the XChem ones, but not the exact same interactions.
Sorry, can you say the
I'm sorry.
part?
So they're in the same pocket as the XChem fragments.
On the XChem, if I remember correctly, there were different pockets, but yeah, it's the same pocket, allosteric pocket that was coming out in the first XChem. In the second one with the atomwise, it was that pocket.
I'm sorry, I don't understand.
All right, so we have done 2 runs of XChem.
Okay.
Right, one with the fragment screening from the XChem library, and then I did the atomwise library. And so on the first screen, we got different binders, and some of them were binding on the allosteric site, or what we are calling allosteric site. Correct. And then in the case of the atomwise, all of the hits were in the allosteric site. So
they were in the same spot.
Yeah, it's the same pocket that was generated. Yeah.
Okay. All right. Thanks, Laura. I'm sorry, I'm slow.
No,
Thank you.
worries.
No, but
so Matt, I guess one of my comments. I guess then, sorry, I for your competition, I think I would, because you have data, I would suggest maybe going driving it on the allosteric site, that pocket. and
Yeah.
focus in on that and let people generate. And that kind of, they have some data that, you can obviously you're sharing publicly, and then, that just gives you some more oomph on, supporting, that area of design hypothesis.
So
The
my
only
assumption,
question was if that allosteric site is actually inhibiting the activity, right?
Well, I mean, yeah, but I mean, at least you've gotten crystal structures there. I mean, we're
Yeah,
struggling, we're
true.
struggling to get, in Mur D, we're struggling to get any kind of, we don't, like I said, we don't really have a good reference other than, ADP or ADP, whatever, PCP, whatever that thing is. So just in terms of having data to kind of support all the ideas people are going to submit, I would think the allosteric pocket would be the one that you're going to have more resources to evaluate the submitted ideas.
Mhm.
yeah. So some of the people interested in this would, as you just said, like any information we have about small molecules that bind in the same place. Sounds like some don't, but some do. So presumably what we can do is say, well, this is the thing that's on the screen here was the pocket we defined for the atomized competition. Presumably a subset of those residues are the ones that are in touch with with some fragments that we got from the screen, the XChem screen. I'm assuming because it's the allosteric pocket, right?
Yeah, so, okay, so from all those residues, there will be more that will be shared with the first SChem screen in terms of contact with compounds, because there were more hits in different areas. In terms of the allosteric site, it will be the same result or very similar result to the atom-wise screen in the XChem, because it's the same pocket.
Yeah,
so, yeah.
But what I mean is the atomized compounds is significantly bigger than the fragments. So I'm assuming that there's a smaller subset of residues that were in touch with the fragments that were found initially.
Yes, I don't know which ones. I can't remember right now. But yeah, sure.
Yeah. So what I was hoping to do is share this and then share the small number of relevant structures which contain the fragments that were bound to the same place, and say basically what we'd like is the design of compounds that are higher molecular weight than the fragments, but which are binding in the same place.
Yeah.
That was kind of the idea. So we could share, in that case, we can share all of the structures which have the fragments bound in the allosteric pocket, and we can share the structures you found of the atomized compounds also bound in the allosteric pocket, and say ultimately that we want compounds bound here.
Yep.
Right. So I guess on us is to list all of those relevant structures so that people know what we're talking about.
Yeah. Perfect.
That's good. Yeah, carry on, Chris.
I was going to say, how do you pick a winner?
Well, I mean, best KD, right, or something, or yeah, you see, that's a good point, right? So do we go for the best result or the best ligand efficiency?
Ligand efficiency.
I don't know.
And what do you do with people who propose compounds that you don't want to make?
That's iterative. I mean, we had that in the malaria competition. There were some really beautiful structures that were suggested as targets for that, and we basically had to say we can't make that. There's just no way in the time frame we have available. So we will be going back to people who would provide really elaborate structures and say, can you simplify, please?
Or make it.
Or yes.
Yeah.
Or make it yourself. Yeah.
Yeah.
Okay. Thanks for that. I just it may not lead anywhere, or it may lead to a brand new set of compounds that are useful. Ultimately, if we got a micromolar binder, it would be really fantastic. So it's worth a shot, and we have some resources for 4 months of work, so we may as well go for it.
So Chris, I'm sorry, or Matt, I'm sorry again. Just, I don't know, in terms of I don't want to call it the parameters of what people can actually do in terms of this quote, what do you call it? Not iterative.
Generative.
Generative, excuse me, generative methods. I mean, so at that level, can they use one of the existing fragments and then use whatever pharmacophore touch points in the binding site, and then kind of do some kind of de novo iterative design based on, using that initial fragment as a starting point. Was that legit?
I think it's legit.
Okay, I'm just thinking that, I think the more you can define kind of what approaches can be used would be probably useful to whoever's going to be competing or submitting ideas.
Yeah, so I was going to put a caveat in the rules about exactly that. So what I was going to say is that if you're going to use an existing binder to predict a new one, that the new compound needs to be at least 3 heavy atoms heavier than the original, which usually means you're adding on about 50 molecular weight kind of thing. Just to make sure that we're not just going to get a fluorine-chlorine replacement kind of thing.
Mm-hmm.
But yeah, we'll see. I mean, that's kind of not the idea, but it's not that would still be useful, right, if that happened. Because as you know, anyone who's done fragment work, right, just elaborating a fragment is tough. All right, great. I think we should move on just in the interest of time. Jan, are you now with us at a desk, or are you still on the road? Oh, he's on. Okay.
Yeah.
Okay. Is it a good time to have a conversation about how best to get structures?
Sure thing.
So you posted very nicely a new structure which Joe was looking at. Wait a minute, let me just get that up. I think I'm looking outside here, and there it is. So yeah, new structure, which was great. So Pseudomonas Mur D in complex with ADP. Really fantastic to see that. And then Joe was posting firstly some analysis of this structure, and secondly was talking about truncated versions of proteins as a better way of getting structures. Either of you, would you like to take up the discussion a little bit here?
Go ahead, Jan.
Well, I mean, the approach of truncating proteins to get better structures or get more easily crystals, that's a well-known approach. It has been employed here, for instance, for any of the Mur C proteins. If we call it anything other than AB1 or BB1 in our SSGCID nomenclature, it's a truncated protein. So for Mur C, we have quite significantly truncated the protein that eventually gave crystals. I think for Mur D we had 2 different constructs, or I know for sure we had 2 different constructs in the running. And I think for one target, the full-length protein crystallized better. For the other target, the slightly truncated protein crystallized better. So that's as much I can say. I don't know what Joe's ideas were, what we can do. Obviously, what we can be guided with is what is ordered in a crystal. So the very naive approach is just lob off whatever is not ordered in a crystal, and that might give us better crystals. But you also run into issues there that proteins might not express if you truncate a certain region, even though it might be disordered in a crystal. If we are going for that, we should consider timelines. We wouldn't be able to get purified protein within, like, at the very, very best 2 or 3 months, I would say. So if you want to have something right now, we are better off trying to get more protein, or just crystallizing the same target again. I think that's
also just
what I can
comment
think.
that also these proteins are very flexible, and we are seeing a lot of movement on the loops that might be. And so, for example, for the allosteric side, there's interactions with a loop. So if we remove that loop because it's not present in another structure, and it's made contact with a new compound, it's quite difficult to know which parts to remove from the structure, even if they are not seen in other crystals.
I agree.
All right.
So,
So I
yeah,
guess
sorry. Yeah.
that's okay. No, it's when you guys are done. So Matt, do you have go farther down there where I have? I just posted, I guess this morning or yesterday was the various structures of the Mur Ligases.
Yep.
So I think the main thing here, I guess, is that here. So so these are some of the examples of the different Mur C, Mur D, Mur E, different species and so on. So so if you can see the truncation in Mur C, so it's the normally these things have like 400 and some amino acids. And so in Mur C, they truncated off about 100 or so amino acids. And the part that's truncated is this domain kind of on the right-hand side. Do you see whether it's in Mur D or Mur E? You see this piece that's missing from Mur C. Okay, and so I've shared literature in the past where there was a lot of work was done by NMR and other techniques looking at, for example, E. coli Mur D, and basically that domain on quote the right kind of opens and closes. So this is very flexible, and I think that's my thinking about if we remove that. Now, all the issues that I was talking about in terms of, does the protein still express? Can you get enough protein if you make that kind of a truncation or not? So there's definitely this engineering challenge and unknown, uncertainty about, what would actually happen for these different species, different Mur ligases and so on. But it just seems like, there's just been so many challenges. I mean, even, Jan, you talked about, getting the structure, this Pseudomonas Mur D structure, the one in the middle, top middle purple structure, was ultimately you got a nice data set, but I mean, it was, and you had the actual APO. I didn't put the APO in here. In the APO, there was a large domain movement of that piece on the right. So it closes down somewhat on binding of ADP. So anyway, I guess, from a structure-based drug design viewpoint, it would be nice to have a system that, would really work well. And I guess that's just my thought, that is it worth thinking about, for example, Mur D, of trying a truncated version and seeing if that ends up behaving better from getting crystal structures. So that's the thought, but it's just, clearly there was quite a bit of work done at SSGCID on the Pseudomonas Mur C. There were 4 different, or I think there was actually 5 different constructs that were generated to get the structure for the Pseudomonas Mur C. So obviously, there was work involved, and it's a matter of, is this something that the team feels is worthwhile doing? And I guess you can kind of guess what my view is. But yeah, there's this big
well, no, I can't guess, because when I look at this figure this way, it looks to me like with that extra lobe, it's making ligand contacts, and so
yeah, I was thinking the same.
That we don't want a Mur D without the lobe. We want a Mur C with that lobe. That would
actually I don't think that's necessary. So if you look, actually the AZ compound, well, okay, we don't necessarily know. I mean, so my original SAR comment about why we weren't seeing activity in Mur D for the AZ compound was because of that helix. If you look at the helix there in the Pseudomonas Mur D, it looks like it's jammed up against it. But we know that if the lobe was on Mur C, if you had the full version of Mur C, it would have that second lobe, right? That second domain. And that helix is, if you look at all the other structures, that helix is somewhere in the vicinity, but we know that those AZ compounds are almost subnanomolar against Mur C. So somehow, you can have that lobe and that helix of that other domain basically stacked up against that AZ compound in a positive way, but it doesn't seem to work based on Laura's data. I think it was Laura's data or Adrian's data last meeting, that they weren't really seeing any activity against Mur D with Yuhang's compound, if I recall. So I think the interactions you probably want, if you think about, at least, okay, my philosophy or strategy would be, when Becca and I kind of worked on designs here, most of the interactions are with this conserved asparagine, and then there's a helix on the back side that the phosphates interact with, and that's where most of our design strategy is going towards, which does not involve any of the residues kind of involved with that lobe on the right. So I would actually avoid that for given, for the, and you don't see, I didn't do the superposition, but if you superimpose these various mirrors, and if you look at kind of the ATP site itself, it's hot, it is fairly highly conserved. And so you go after the conserved interactions within the ADB site. Anyway, I mean, that's, again, that's, someone else has to put all the elbow grease in to actually generate it and, generate the clones and express them, purify, do phytocrystallography, et cetera, et cetera. But it just seems like we've struggled to get good crystal systems at this point. And so this would be maybe one thought we could consider, one approach.
Yeah, so we can do that. Like we can put them sort of in our pipeline. Jan is correct that there's a bit of a backlog and we're in the middle of our competitive renewal. So, I think we have about 5 more months of funding left or so. But we can make those and put them in our you can even make them actually. If you want to design constructs and send them to me, I can put them in for sure.
Yeah, I was gonna say that another option, I can purify them. If you give me the constructs, I could do the other half. But the only thing that worries me is that we will be missing. I understand your point, Joe, but I was like, every time I'm thinking about that, it just makes me worry that we are missing as well other contacts. But it's true that we are struggling in general to get a good system for crystallography so far. But
I think it's in part we have to think about what the struggles are. I mean, Laura, you said you get microcrystals. That's a different challenge from crystals that crack under cryoprotection that I had with the Pseudomonas muridi.
Yeah,
so
but
I think
that depends. Yeah. So the microcrystals is the co-crystallization. So I do get apocrystals for Mu E and Mu D. In the case of Mu D, those are the morphism ones, and I need to test it against more compounds. But from the first screen, a small thing that I did, there was only one hit, and it was in this pocket in a crystallization contact, and it's a really nice pocket for things to be binding to. So it's a point on the packing. So I'm trying to get new crystal packings now. And the other one, the process of doing the SCHEM, the soaking, is quite tedious. And also we are not seeing things that can translate into good inhibitors yet. And it has these like very flexible areas. It's a very open conformation as well. So we got a more closed conformation, we might get better binders. So it's about the conformation where it crystallizes. And I haven't been able to crystallize that E. coli Mur E on a different conformation.
And that's a struggle we run into various branches of our operation several times. That early on in a program when we have weak compounds, we can't really stabilize our wanted conformation good enough that we can reproduce that in crystallography. And we've been trying and trying and trying. And eventually when chemistry provides good enough compounds that really stabilize the conformation that we intend, then things work much easier. But it's hard for us in crystallography to sort of anticipate that.
Sorry, but somebody may have already said this, but having doing a full length Mur C rather than a truncated Mur D, was that something which would also take time? Because it's a new request, right?
Well, that's something we've already done before.
With the same inhibitor band.
No, I'm saying we tried to make that protein previously. I'm just trying to look it up.
Yeah,
Yeah.
no, you
Right.
made, yeah, so you made, yeah, so there were, as I said, Matt, yeah, so basically they did 4 different constructs, at least 4, and several of them were full length, and they clearly, either they didn't get a good expression, enough material, or they didn't get good crystals. So that they ultimately, the only way they got a structure with AZ compound was this truncated version.
Yeah, I'm trying to look through our database, and the only,
No, I remember.
at least for the
I put
pseudomonas-
up the, I think you scroll back up,
Hang on.
Matt, I have the constructs was in the, right there.
right, and I'm looking at our internal part of this
Okay.
protein, and all of the purifications failed for like 1 and 3, the full length, and the 1 and truncation 1 and truncation 2. When I look at those in our database, as well as truncation 5, anything that's basically larger didn't make it. So it never actually made it to Jan to attempt when I look at it.
Mhm.
Purification failed. It's K12 and 1. Anyways, that's
Okay.
for Pseudomonas. We pretty much, our standard procedure is to send the full length through first whenever we do anything in the target. So we would have done all the full lengths before we did the truncations. Doesn't mean they couldn't be tried again, and also doesn't mean that they couldn't be optimized, because we're not terribly, we throw a lot of things and we don't spend a lot of time optimizing. Something fails and we move along to the next thing. So there's room for more work here, and we do have the materials. We have the clones and stuff. Laura, did you ever receive your stuff from us?
Yes, I was gonna mention that. So I did get Pseudomonas protein and constructs as well. So I did set up for Mur C. I set up some crystal plates with the full length protein, APO and ADP. No, AMPPC, sorry, ADPCP. Oh, yes. Yeah.
So excuse
so
me,
I
which
did-
protein was that, Laura?
was the Pseudomonas Mur C full
Okay.
length. I recently got it, so things
Okay.
haven't grown yet, but
Okay.
I will check them again on Friday and see if
Yeah.
anything has grown. Obviously, if
Yeah.
anything grows, I'll let you know, because
Yeah.
and I'm getting new crystallization screens as well in a couple of weeks, so I will try those too.
Okay, so that's full length Mercy.
Full length Mercy Pseudomonas, yeah.
That you got from us, protein purified?
Yes.
All right. I mean, I'll take
I
your
do
word
have the
for it.
vectors.
I'm just looking in our database. I don't see that we ever purified it, but I must be confused.
I'll double check, but yeah, I'm pretty sure.
Yeah, I
we
don't see that
did.
either here.
Maybe it was a lie of a full length. Yeah, that's what it was saying on the table they sent me. With all the samples that they were sending me. But I do have the vectors. I was planning on purifying anyway. And the
Okay,
thing,
great.
I was also waiting for the E. coli constructs, because I also requested E. coli constructs, and they are being cloned. So I was waiting for it to arrive and then do all the expressions, purifications, etc.
Okay, so take home is that we'll wait for those results, obviously, Laura. Take home is that making truncated and versions of MURD and MURE would be difficult. Well, not difficult, but would take time at SSGCID.
Yeah,
Right,
so
if you want-
I could follow up after the cloning. You know, if for example, SSGCID can do the cloning, I'm happy to take the expression purification. Maybe that way it's faster. I don't know. I don't know how long it will take in the cloning pipeline, basically.
I can't comment on that. That's out of my
Yeah,
hands.
yeah, it does.
Okay, just in the interest of time, wanted to make sure we cover anything else that we need to do here. So, Yuhang, I'm going to sort of summarize for you. Sorry, you've posted your synthesis of the AZ5095 compound is done, and you're now making steady progress towards the amino version of that compound, which is great. So work is ongoing there, and Yuhang's making steady progress. For the computational modeling, Jan already posted some updated structures last time for the last meeting. We've just done a synthesizability and procurement analysis here, which I just need to run through with Yuhang and with Ed, so that we can think about which compounds we can get still and which compounds we might want to make, given that there are some big disruptions at the moment to synthesis on demand. So we just need to have a fresh look at how we might get some of those compounds and evaluate them. So we'll update people next time on whether we're going to make those and what we can do. And there was, Laurie found this Merck Open Global Health Library, a bunch of compounds available from Merck that we could request for free if we wanted to. They come in this form, so 30 microliters in a concentration of 10 millimolar in DMSO. We can just acquire those compounds if we want to, and we will be able to post the data on any hits we get, I think. So I was hoping to convince the Warwick team to act as receivers of the compounds, which means that you would have to engage with Merck in terms of signing a piece of paper. So I can bring that up. I was going to bring it up with Chris today, but he's not around. So I might do that offline. But that could be a bunch of compounds that we may not have. I don't know what the library contains, actually, but it could be a different set of compounds to ones we've already evaluated potentially.
Okay, good. Yeah, he's away today, so.
Okay. He's got a bunch
it's better
of...
to send him an email. He might be able to reply this evening.
Okay. Okay. And then there are some other multiples there and stuff. All right. Did I forget anything, or anyone wants to raise anything?
Just a quick question on this competition. Where will you announce it?
Well, here actually.
Here.
So,
okay.
Wait a minute. It's draft still, but it's there. So we're just not quite done with it yet, but we'll once we're happy with the text, and now that I know that we're happy with the target, we can tweak this and get going. There's a guy called Brooks Page at UCL who's part of the Turing Institute, who's one of the machine learning guys who's driving it, and Peter Coveney does a bunch of stuff on predicting molecules that bind to proteins in chemistry here at UCL. And we got this money to run a competition, but we're going to try and involve others. The aim of the competition is to develop a community of generative people around a particular problem and share what works well and what doesn't. But yeah, I'll be in touch with you separately, Jan, about this and make sure that it's reasonable and that you're aware of what needs to be done. Obviously, it'd be great to have your inputs. Yeah. Okay, anything else people want to mention? I think we're just about out of time, but I don't want to have missed anything important that people want to say.
It's just one last thing. I remember I posted a request on on the last February meeting, issue 66, about two structures. I think, Matt, we've discussed about it. So that two molecules were based, the last page, latest match, all the way. Yeah, that two structures.
Oh, this is a request for Jeff.
Yeah. So
okay.
do you think we can just send it for biological testing and crystallography just for fun?
I think biological evaluation is less of a challenge if Warwick has a decent throughput assay up and running, but we have to have a good justification for it, which I think you've got that. But
yeah, we
but
have
yeah,
those samples. Like,
we can be in touch with the Warwick people after the
Yeah.
meeting and make sure that they'd be happy to screen them if we sent them.
yeah. Right. Thanks.
Okay, all good. Thanks very much, everybody, for coming along. I'll try and post some updates, and we'll talk to each other offline and then next month.
Okay.
Nice to see everyone.
Right.
That's good. Bye bye.
Thank you all.
Bye.
Bye,
Bye.
everyone.
Thank you.
Bye.
Bye.